Good afternoon, everyone, and welcome back for our daily briefing. Today, I'll provide the update on our state COVID-19 metrics, as well as our weekly review of our statewide hospital capacity data on three of our major metrics: hospitalization numbers, ICU numbers, and ventilator availability. First, new cases and new tests, as well as the percentage of tests that were positive over the last 24 hours. Today, we are reporting 2,341 new cases for a state total of 63,840 cases, which includes many individuals who have already recovered. 13,834 new tests were reported over the last 24 hours. That's a statewide positivity rate of 17%, though that looks different at different testing centers and across different demographic groups. Over the last 24 hours, we've also lost another 46 Illinoisans to this virus, a total of 2,662 known fatalities in Illinois since the beginning of this pandemic. May their memories be for a blessing. Now I'll get into a few other metrics, but first I want to remind everyone that snapshots in time alone are not enough to offer a full understanding of where we are, but together they can offer some indication of how things are trending. I'll start with our progression of statewide hospitalization numbers over the last month. That's the total number of both COVID-19 patients in the hospital and assumed COVID-19 patients in the hospital in any condition. So on April 5th, we had 3,680 COVID patients in the hospital. On April 12th, 4,091. On April 19th, 4,599. On April 26th, 4,672. As of midnight last night, May 3rd, that number had reduced to 4,493. I'll also offer the same time series progression for our COVID-occupied ICU beds, and then give you a sense of how many ICU beds are currently available in hospitals around our state by IDPH region. On April 5th, COVID patients occupied 43% of our 2,709 ICU beds. On April 12th, they occupied 39% of 2,991 ICU beds. On April 19th, 40% of 3,134 ICU beds. On April 26th, 34% of 3,631 ICU beds. And as of midnight last night, 33% of our 3,681 ICU beds, which when combined with the ICU beds occupied by non-COVID identified patients, leaves about 933 ICU beds available statewide. Of course, that ICU bed availability looks different in different parts of our state, so let me offer you a sense of that and how it looks by IDPH region. And those regions, by the way, are designated by their interconnected networks of emergency medical services. These are the regions that pre-existed the novel coronavirus. They are, in the Rockford region, 51.5% of ICU beds were available as of midnight, and that's about 86 beds. In the Peoria region, 40.2% of ICU beds were available, and that's about 101 actual beds. In the Springfield region, 54.3%, or 82 actual beds. In the Edwardsville region, 27.5%, or 25 actual beds. In the Marion region, 27.5%, or 41 actual beds. In the Champaign region, 44.9%, or 62 actual beds. And in Cook and the Collier counties, In the city of Chicago, 16.9% of ICU beds were available as of midnight. That's 186 actual beds. In the southwest suburbs, 17.9% or 94 actual beds. In the west suburbs, 15.9% or 77 beds. In the northwest suburbs, 38.3% or 152 actual beds. And in the north suburbs, 11.9% or 27 actual beds. Now, that's a whole lot of numbers, I know, so I want to remind everyone that if you want to check out our hospital utilization data in your area, you can find that information laid out visually on the IDPH website, dph.illinois.gov. And remember, these numbers fluctuate not just day by day, but hour by hour. Finally, I'll briefly touch on ventilators. Our medical professionals continue to innovate treatments to help patients avoid the need for a ventilator, though this equipment can and has saved lives. It begins a very difficult recovery when people are intubated, and it's no doctor's first choice. That said, we continue to keep our eye trained on the number of Illinoisans with COVID-19 who are on ventilators. And from a statewide standpoint, we've continued to see a slight downward trend on this metric from 29% usage on April 6th, then 25% on April 14th, then 23% on April 26th. And of the 4,493 Illinoisans in the hospital, 763 are on ventilators. And that means 22% of our total ventilator inventory is currently in use by COVID-19 patients. That's a lot lower than we had expected at this point, and it's because of the amazing work that people have done staying at home and following our executive orders. I want to again make a call to our workers in nursing homes, hospitals, clinics, law enforcement, and other frontline occupations to help us stretch our PPE stocks further through the use of our new N95 mask decontamination system that's currently deployed in Waukegan. This is a fully free service, door to door. FedEx and Cardinal Health are handling the transport of masks from facilities to the decontamination site and back. And the U.S. Health and Human Services Department is covering all the costs of using this system. Each mask can be contaminated up to 20 times without experiencing any degradation of filter performance. So I want to encourage facilities that have masks to send them for decontamination to our Waukegan facility. I highly encourage people to take advantage of this equipment that's being provided through IEMA. And again, it's fast, it's free, it will help us help you by freeing up PPE as we're acquiring it from abroad. IEMA is ready to assist with the sign-up process for your facility, and they're available 24/7. To register, these facilities must enroll at www.battelle.org/decon. Again, that's Battelle, battelle.org/decon. DECON. Before we move to press questions, I want to let everybody know that today kicks off Teacher Appreciation Week. Educators have long been a special type of unsung hero, dedicating their lives to giving the next generation the tools they need to build a better world. And now, in this pandemic, millions of teachers have stepped into new roles as meal distributors, as tech support staff, 3D printers, YouTube stars, lesson innovators. They're only human, doing their best to do their jobs and to see their students through an unprecedented situation. And by and large, they've shown us their extraordinary compassion and creativity, and I'm so grateful to them. To all the educators watching, thank you for stepping into a role that you may never have expected that you would need to fill, all the different roles that you're filling right now, and I'm so very grateful to you. If you're not a teacher but you know one, I hope you'll take a moment to thank them today, call them, send them a note online. A few kind words goes an awfully long way, so I would appreciate if you'd reach out to them today.